Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by Assistant Director of Metro Health, Dr. Anita Kurian, as well as Dr. Charles Hankins, who is the President and Chief Medical Officer of the Children's Hospital of San Antonio, and this is our COVID-19 update for the San Antonio community. Today we are reporting 1,681 new cases of COVID-19, so our 7-day moving average is now 1,278. We are sadly reporting a number of new deaths, 23 today. We've lost a total of 3,936 people to this virus in our community. Please keep them in your prayers this evening, along with their family members. Too many of our loved ones' neighbors have been lost. In our hospitals tonight, there are 1,268 patients in area hospitals. There were 195 new admissions in the last 24 hours. So as our hospital census has dipped slightly, we are still seeing a record number of new admissions staying near those record numbers each day. There are 361 patients in ICU and 234 on ventilators with COVID-19. Worth noting again that 85% of patients in area hospitals are unvaccinated. 31 patients are children. Just a quick update on our vaccination efforts. They are continuing at full speed, so if you know someone in your family who is eligible and has not received one, please encourage them to get their vaccination. Currently, there are more than 1 million Bexar County residents that have been fully vaccinated, and 1.4 million have received at least one dose. Remember, children younger than 12 are not yet eligible for the vaccine, and they do account for about 20% of our population, so it's incumbent upon everyone who is eligible to get vaccinated to protect those younger people in our community. Let me turn it now to Judge Wolff.
Thanks, Mayor. You know, like you say, 192 more in the hospital, but I think things are a little bit more difficult out there than what we might see, that the hospital beds are coming down. Out at the Fusion Center, we've never had a load of people like this before. We've done 2,249 cumulative infusions of Regeneron and other monoclonal antibodies to help people where they don't have to go into the hospital. Just these last 7 days, we're doing 120 a day. The most we ever did in our previous one, in the previous surge, was at like 90. So people are taking advantage of that. That's helping keep them out of the hospital. There's some innovative things helping also. University Hospital, Bexar County Hospital District, is doing a hospital at home, I guess you would call it, where they've identified a patient, and the house is a good place to be, and it's a close distance to the hospital, where a nurse will be available all the time and where they will go out and check on them. And that's helped relieve the pressure on the hospitals also. Just in the last, since July the 17th, the patients who have qualified to do that from our hospital has opened up 45 available hospital beds, and they plan to continue to do this through the pandemic. And as you know, it's not that far away where we'll be entering the flu season, and there has been some notice out of England, particularly from their chief medical office, that we may be facing a more difficult flu season, because last year, a year ago, we were all much more cognizant of social distancing, cleaning our hands, wearing a face mask. We've got a little sloppy on it now. Many school districts not even requiring that. So it could be a bad season for us. So what we're doing, the Commissioner's Court has set up 4 different mass vaccination sites for the flu. One will be on the September the 18th out at the Coliseum grounds. Another will be on September the 25th at Southwest Independent School District. Another one at Dub Harris Athletic Complex on October the 9th, and then one out at the baseball stadium on October the 16th. So we'll be getting you more information about that, so we encourage everybody to also get their flu shot and be prepared for the flu season that we'll be facing.
Thank you, Judge. And also, Labor Day holiday is coming up, and we want to spend it with our friends and family, many of us barbecuing as we usually do every year. But please note the numbers and the indicators are starting to improve, and so we need to remain vigilant in our fight against COVID-19. If you do choose to gather with others, we encourage you to keep it small and do so outdoors in well-ventilated areas. You might also, instead of family-style meals, use individually portioned and packaged meals and snacks. That's always a good idea when there is this type of infection transmission going on. Regardless of your vaccination status, mask up around others. Wearing a mask is still the easiest thing to do for anyone to slow the spread of this virus. And remember, again, that the choices that you make over this holiday weekend will determine how much longer this surge of COVID-19 lasts. So please do your part to help us to contain this virus. And it is Labor Day. We are celebrating the work of many of our frontline employees, especially our nurses, our doctors, our teachers, our frontline employees who have been toiling away for the last year and a half trying to get this under control and protecting us and our health and safety. So keep them in mind and do what you can to ease their burden. Finally, to find a testing location, you can visit covid19.sanantonio.gov. You can also call the COVID-19 hotline by dialing 311 and then hit option 8. Please wear a mask, get vaccinated, do it for yourself, do it for your family, and do it for San Antonio. With that, myself, the judge, Dr. Kurian, and Dr. Hankins are available for questions.
With Labor Day around the corner, is there a possibility of establishing a curfew to mitigate the spread of the coronavirus and the Delta variant?
Governor's done everything he can to make sure we never do anything to protect any people. He's pretty well shut down our whole emergency orders. No, I don't think we can even do that.
And I don't think it's necessary. We have the tools to slow the spread and stop this virus right now if people would just use them. Wearing a mask and getting vaccinated can end this pandemic altogether. We won't have to be talking about these other mitigation measures if people would use those consistently.
Do you anticipate a surge following the Labor Day weekend?
I'll ask the doctors about that.
Historically, we have seen case counts go up after long holiday weekend. So this is not going to be any different, and that is why we are making sure we are amplifying our message about staying cautious during this Labor Day weekend.
What impact do you expect the Delta variant to have on the tourism industry this holiday?
It's already had an impact. The unmitigated spread of COVID-19 has already caused cancellations of events. We've seen it. And you probably know someone, if it not yourself, that has canceled travel plans because of the concerns of COVID-19. We don't have to be here. This is entirely too frustrating for us because this can all be prevented. And it's the same way with schools. We're hearing about schools being impacted and some even closing. We can stop that. We don't have to go through that if people would just mask up.
Yeah, now we got a Delta Plus variant coming, and I don't know exactly what that's going to mean. Is it any worse than Delta? But that's evolving, and so we don't know what to expect of that yet.
Mayor and Judge, have y'all had a chance to go to the infusion center since it opened? I know y'all went before it opened. Have y'all had a chance to go since then?
I haven't been back there since we opened it up, but
No, I haven't either. I've talked with them, 2 or 3 times a week just to see how we're doing and is everything working okay and how many we're doing. And I'm just astonished that, well, I'm not astonished. I'm glad people are taking advantage of it because it's stopping them from overloading the hospitals, and it's working very well from what I can tell.
Do y'all feel like it's making an actual noticeable impact on our hospital capacity?
there's no doubt that it is. I mean, again, we're at record levels in new admissions every day, and we're seeing a slight downturn in our hospital census. So those patients are going somewhere, and I think a lot of them are being diverted because of the therapies that they're getting at places like the infusion center, and also the fact that the hospitals are getting much more adept at treatment. But Dr. Hankins probably can tell you a little bit better about that.
Yeah, like what Judge Wolff said, we're trying to get better and better about doing things at home, monitoring patients at home, measuring their oxygen constantly at home, and really trying to shift it. This is a different. If we had kept the same patients in the hospital this wave that we did a year ago, the numbers would be much, much higher. So it is different. It doesn't mean the disease burden is less. We've adapted, and there's a lot more care being delivered in alternative sites. The long-term acute care hospitals and the rehab hospital, everybody's pitching in to carry this burden this time. So, last time we may keep a patient in the hospital for a couple of weeks. Now we may keep them 5 days and then shift their care much quicker to another facility or to their home.
For the doctors on the panel, what should people know about the at-home COVID test, and are they accurate?
Yeah, there are several FDA-approved home tests that are pretty good. So, yes, they are accurate. But my recommendation is, if you are symptomatic, always do the home test, but have your physician consult as well.
Last Thursday, Judge Wolff mentioned that the health of children would be facing a triple threat this year, referring to COVID, RSV, and the flu. Have there been any flu cases registered here in San Antonio and Bexar County among children or adults this year, and if so, how many?
Well, from our standpoint now, the flu is still nascent in a way. It's there. It's beginning to develop. I'm aware of one child in Comal County, New Braunfels, and I heard we've had one positive here. So right now we're seeing a little bit of pop-ups, but flu has not hit like COVID and RSV have right now. And so, yes, if that does pile on, it will be the triple threat.
I think we'll know a lot about that when the flu season gets here, generally October, November.
Is there reason to believe that this year there will be a rise in flu cases? And if so, why?
Well, the only thing I was citing, as you know, Great Britain catches it before we get it. And we learn a lot about what happens over there and what would be done. And one of the warnings has come from chief medical officer in Great Britain. They're fearful of a season simply because we had a lot of mitigation efforts that were going on. Last year, I think a lot of kids were taking remote learning at the same time. And so there's a lot more interaction today, and a lot of people just not caring about whether they wear a mask or not, or whether they keep social distance. So we don't know, but there is concern that it could happen.
Dr. Curry, when will Metro Health start administering the flu vaccine this year?
I just got word today that our flu shipments will arrive sometime towards the end of this month. So we will start administering it as soon as possible. However, I need to say that there are other outlets in the community that already have flu vaccines. So if you have access to flu vaccine, since it's available, please take it as soon as possible. Like Dr. Hansen said, flu is already here. Don't wait for October 1 for the flu season to officially begin.
With positivity rates kind of on the downslide, I mean, they're still high, but they're on the downslide. A lot of people might be taking that as a sign to return to normal. What is y'all's message to them?
Stay vigilant. We're not at the point where we can take our guard down by any stretch. We're still in double digits on positivity rate, and we know we're getting thousands of cases every single day. And we're entering into a period where there's going to be increased activity. So that the combination of all those things puts us in a very tentative position. If we aren't interested in moving on beyond COVID-19, we would be especially vigilant right now when it feels like things are beginning to move in the right direction.
It's, as long as we are getting as many people coming in the hospital, I think we're all concerned. Last 3 days, we had 191 one day, 190, and then 195 on our last day. So they're coming in, being treated and doing everything they can to help them. But till the incoming patients start really dramatically going down, I think we're going to still have a problem.
And I just want to add, we've seen this, the positivity rate, we've reached the lowest positivity rate of 3.6% and then have come back up again. And that's because we've let our guard down. So for folks to think that we are towards the end of the pandemic is the wrong message to have. We are in this for a long haul. you cannot take the eye off your ball. You need to remain vigilant, like the mayor has said.
And also, I mean, just as a reminder, the hospital system in particular is extremely stressed, and that's important for you regardless of whether it's COVID-19. If you are calling for emergency services, emergency health services, we're at a tipping point. If it gets worse, you might not have service available for you. So it's incumbent upon all of us to bring those numbers down, and we're definitely not there yet.
Dr. Kurian, is it more important to be aware of the flu now than later?
Absolutely. We say don't wait for the flu cases to have high number of cases in the community. The best time to get vaccinated is before the cases come, before you start seeing those cases. That's when you can make the most impact in breaking the chain of transmission of flu during the flu season. So, yes, you need to be always aware, and flu is already here. So if you have access to the vaccine, please get it as soon as possible.
Nueces County confirmed their first case of COVID Delta Plus. Why is this a variant that we should worry about, or is it one?
It's again one of those variants of concern, and every time you find a new variant, it's indicative that the virus has learned to mutate itself. So the fear is that we may encounter a mutation that might evade the vaccine immunity. So there's always a concern when a new mutation is discovered.
With high school football now underway, are there any procedures student athletes and coaches should be doing to keep teams from spreading the virus among players?
Get vaccinated?
Get vaccinated if you're eligible to get vaccinated. If you're unvaccinated and you're playing the games regularly, I think in this climate of high transmission, it's prudent to get tested at least once a week. If you're sick, please stay home. Don't come in to play the game. Practice good hand hygiene. And I just want to caution, last season we saw more cases happening because of things that they were doing off the field than on the field. So you have to remain vigilant both on and off the field.
That's all we have tonight. Thank you.
Thanks,
Thank
y'all.
you.
Have a good weekend. Happy Labor Day.